welcome to the 14th part of our RRB MCQ series. So till now we have completed 13th part already and have discussed many questions. So in this series, this part we are going to further discuss some important questions that have been previously asked in RRB examination. So let's begin. So here the question 1 says, the presence of envelope shaped crystal in urine indicates the presence of. So this question is from topic stones, kidney stones, and here they are asking about shape of the crystals and they are asking about envelope shaped crystals. So option A is struvite, option B is uric acid, option C is cystine, and option D is calcium oxalate stone. So if you have known the shapes, you will be able to easily identify here. I have also made a special video related to stones. So if you don't know the shapes, you can also watch that for context. So here the answer will be calcium oxalate stones. So calcium oxalate stones, they have envelope shaped crystals and they can be seen in urine microscopy. So here you can also see the figure. They generally look like an envelope. Moving ahead to the second question, it says, what calcium sensing receptor blocker, a drug used in chronic kidney disease, is used for MBD, that is mineral bone disease? So we have to choose a calcium sensing receptor blocker used in CKD. So option A is cancellate, option B is calcium acetate, option C is 1,25 dihydroxycholecalciferol, option D is cholecalciferol. So right answer will be cancellate. So they are drugs under the calciumatic category, and these are calcium sensing receptor activators used in CKD patients to treat secondary hyperparathyroidism and in mineral bone disease. Moving to the next question, it is saying chloramine exposure in hemodialysis may cause what? Option A is bleeding, option B is pericarditis, option C is hypernatremia, and option D is hemolysis. So if a person is exposed to chloramine or the blood is exposed to chloramine, what is going to happen? So it is going to cause hemolysis. Now chloramine contamination in dialysis water damages RBC membrane leading to acute hemolysis, a serious dialysis emergency. Moving to the next question. Here it says the sign and symptoms of kidney disease are all except. So option A is general weakness, option B is pallor, option C is increased appetite, option D is nausea. So increased appetite is not a symptom or a feature of kidney disease. So this one is the odd one out here. So CKD commonly cause weakness, pallor, nausea, and usually have loss of appetite. So increased appetite is the wrong option. Moving to the next question, it says, which of the following IV iron is associated with serious anaphylactic reactions? So we have to choose the type of iron that is responsible for serious anaphylactic reactions are nowadays seldom, not commonly used. So option A is iron dextrin, option B is iron sucrose, option C is sodium ferric gluconate, option D is ferric carboxy maltose. So the right answer will be iron dextrin. Now why so? Because iron dextrin carries the highest risk of severe anaphylactic reaction. It is a large molecule and it generally cause anaphylactic reactions. So that's why this is now seldom not used. For giving iron or IV iron, we generally prefer iron sucrose mostly, and then we go with other choices like sodium ferric gluconate or ferric carboxyl maltose. Moving to the next question, it says following are the indication of plasmapheresis except. So we have to find the exception, which is not indication of plasmapheresis actually. So option A is Hus nephropathy, option B is good posture syndrome, option C is GB syndrome, option D is ABO incompatible transplantation. So here Hus nephropathy is not indication for plasmapheresis, while good posture syndrome, GB syndrome, glomerular basement syndrome, and Guillain-Barré syndrome and ABO incompatible transplantations are symptoms or indications for the plasmapheresis. Hus nephropathy is not a routine indication except selected atypical cases. Moving to the next question, again it is from the stone part, and here they are asking which one of the following is a radiolucent stone. So there are mainly classified into two types. One are radiolucent that get illuminated, and another are radio opaque. So they don't illuminate light, and they illuminate light. So option A is cystine, B is uric acid, option C is calcium, and option D is struvite. So here the answer will be uric acid. So uric acid stones are radiolucent, meaning they are here. It is wrong actually. They are visible. They are visible on plain X-ray imaging. Like here you can see it is emitting light, so they are visible. Moving to the next question. Here it says the following biochemical parameters are elevated in kidney disease except. So option A here are bicarbonate, potassium, creatinine, and urea. So if you see, potassium is generally increased in CKD patients. Creatinine is also increased, and urea on the other hand is also generally elevated. But bicarbonate on the other hand is generally lower, and that's why generally the patients who are CKD generally move to metabolic acidosis because the bicarbonate is lower, and other acidic H plus ions and potassium ions and sodium ions are higher in the body, so making it acidic. Moving ahead to the ninth question here, it says activation of vitamin D by the kidney is through which is an enzyme. So option A is transferase, option B is 1-alpha hydroxylase, option C is alanine glycoxylate aminotransferase, option D is angiotensin converting enzyme. Now we are talking about vitamin D here, so it will be 1-alpha hydroxylase. Here kidney activate vitamin D by converting 25 OH vitamin D into activated 1,25 dihydroxyvitamin D using 1-alpha hydroxylase enzyme. Moving ahead to the last question of this part, here it says the ideal empty bed contact time for carbon filter is. So option A is 10 to 15 minutes, option B is 5 to 10 minutes, option C is 1 to 3 minutes, option D is 2 to 5 minutes. Now you might get confused in these two, but in the books it is suggested. So this was all about the part 14th of our series. There are some corrections, so kindly see those corrections, and I hope you are enjoying this series. Make sure you solve all these questions, and the practice sheets are available in the Telegram group. So best of luck for your RRB examinations, and all these questions which we have discussed in this series have been previously asked in the RRB examinations. So it is very predictable that the questions they are going to ask in this year's RRB will be around these same topics. So make sure you watch all the parts and practice the questions. Thank you. Have a nice day.